One of the core concepts I feel like every NICU nurse really needs to know is thermoregulation. Hey, I'm Amanda. I'm a neonatal clinical nurse specialist, and I want to help you get your RNC or your CCRN, or if you just love to learn about NICU things, I'm here and I want to be your BFF. Thermoregulation is essential for neonates. When babies become cold, it causes the snowball effect of issues that we don't really like. So, just a refresher, when we are cold, there's receptors in our skin that communicate to the hypothalamus in our brain, and that releases norepinephrine. That norepinephrine causes vasoconstriction of our peripheral vessels, which shunts blood to our core to try and warm us up. But babies, they also have a special physiology called non shivering thermogenesis or brown fat metabolism. So they have this brown fat that actually will metabolize super fast and it will help generate heat if they are cold. The thing about this is it costs a lot of energy to do that. In fact, the babies will use twice as much energy, or excuse me, twice as much oxygen, and they will utilize a lot of glucose. So, what do they have risk for? They have risk for hypoxia, hypoglycemia, and other things too. There can be pulmonary vasoconstriction, which increases a right to left shunt, and therefore we have more hypoxemia. We can have impaired immune function, which increases the risk of sepsis, and we can have impaired coagulation, which increases the risk of bleeding. So, as a NICU nurse, it's so important that we can help make sure our babies stay warm, prevent hypothermia. That way, we can prevent all of these problems that can happen. Tell me in the comments, what are some of your favorite ways of maintaining a baby's temperature? I would say mine, 1000%, is skin to skin. If I could get that baby skin to skin with their parents, it's a happy day. But there's a lot of different ways. What do you do? What do you do in the delivery room? What do you do in the NICU? How do you keep your little babies warm?